But we begin as GOP lawmakers had a crucial deadline to meet this week, delivering a majority of the General Assembly's bills to Governor Andy Beshear. Although the session is not quite over yet, Friday was the deadline for any bill passed to also withstand a possible veto, which means the majority of the legislature's most controversial proposals for the year got some attention this week.
This is a week where, especially in a short session, that there are a lot of bills going back and forth. We ask our chairmen to really be judicious with what they do, but still there's going to be some give and take, and there's going to be some things we don't understand the rationale for moving.
The Senate had a lengthy debate this week on this year's priority anti-DEI bill, House Bill 4. We also saw House Bill 90, a freestanding birthing center bill, now with clarifications on conditions for an abortion in Kentucky, move through both chambers on Thursday. And both chambers this week debated Senate Bill 89, a water regulations bill that got concern from environmentalists. These are all now on the governor's desk. So Trey will start, I believe, with House Bill 4. This is probably one of the biggest issues we've seen get attention during this particular session. We've managed to talk about DEI, I think, 3 weeks in a row now on this particular program. What do you think of the merits of this bill?
Look, even Gavin Newsom, governor of California, who's got a new podcast, is talking about DEI and how that got Kamala Harris beat in the election last year. You got a lot of members of the General Assembly who ran on this issue in 2024. They were going to pass something. I think that what they passed is, it kind of is what it is. I don't think it's too bad of an overreach. It's probably going to be about in line with whatever ends up coming out from the federal level, which was going to be imposed on the state anyways. So, I don't know that it's anything to get too worked up about, especially considering, like I said, this was an issue not just Kentucky but nationally that was a huge winner for Republicans, a huge loser for Democrats. Something was going to pass, and House Bill 4 is what we got.
Jared, from the Democrat side, how did y'all see this issue?
Well, I mean, we thought it was much ado about nothing. It was a solution looking for a problem. The problem is, of course, us Democrats, we have a messaging problem. So we didn't explain what DEI was very well, and we got beat with it pretty bad in the election. And so my big concern, though, is there's some, cosmetic changes and whatnot, but I don't think it's ever been addressed on the floor. I don't think we got a clear answer, but if, say, somebody is setting up a scholarship fund only for black students or only for Native American students or for only female students that are poor, veterans is another good one. Veterans is part of DEI. Are they still allowed to do that after this bill passes? Because that's private money. We don't like telling private money what it can and can't do as the government. At least that's what I was taught back in the day. But now it seems like government overreach is telling private people how to spend their money to help educate the less fortunate.
Yeah, certainly a lot of the debate, it seemed to be mostly just kind of focused on history and each side's position on it, but we didn't really get a lot of clarification on some things.
There was a lot of getting your talking points in, getting something you could put on a mail piece or a commercial in the future, and not a ton of substance.
Yeah, well, we got a lot to fit into this segment here, so let's move on to House Bill 90. Jared, you mentioned this is a bill that some changes were able to get in and some work was done on these clarifications. You want to talk a little bit about what was...
So I was involved somewhat in the process. Really, hat tip goes to Representative Nemes and Representative Moser. They worked really hard, and I think a byproduct of the trigger ban, maybe they thought hospital administrators or hospital attorneys would agree on what the danger to the life of the mother is. There's no real agreement anywhere on it. And so what this bill tried to do was say, look, these are not, if you take care of this process, it's not an abortion. If you take care of an ectopic pregnancy, take care of hemorrhaging, sepsis, a miscarriage, those aren't technically abortions. Medically, they may be abortions, but to fall under the volunteer abortion procedure, elective abortion procedure, these do not count. And therefore, that lifted the legal burden away from the doctors being able to perform life-saving surgeries. So honestly, what House Bill 90 will do is prevent people from dying in parking lots that have happened in Georgia and in Texas, and I'm very proud of that piece of legislation, and I'm proud of all the partners that came to the table to work to get something that the doctors could agree on, the hospital administration could agree on, and Right to Life could agree on. And so hat tip to everybody that worked on it. I'm very proud of that legislation.
Yeah, and it's pretty rare to see that many different groups all kind of aligning on this. Is there anything more you wanted to add on that, Trey?
Well, I would say, as someone who does a lot of work with hospitals and is married to a physician, the doctors in this state, and especially the lawyers for hospitals and doctors, we're not a med-mal reform state, which means doctors and the attorneys for them are trained to be super extra cautious when it comes to the law because they're very exposed on the lawsuit side. I think a byproduct of that, with the way that the trigger ban law was originally written, is that cautiousness carried over to their interpretation of this, and whether these procedures were actually banned or not, they were interpreting it as conservatively as possible, and this law provides clarity to where now the attorneys.
I like how Trey blames med-mal for that, but I'm going to blame the fact that during the trigger ban they put a felony penalty for the doctors. The doctor can lose his entire way of livelihood if there's some out there prosecutor somewhere that's zealous and looking to pick a case, and the doctors don't want to lose their livelihood. Now, if he had made it a felony and you'd left it up to civil punishments, or have the KBL board, whatever the board is, the licensed doctors, as the deciding factor, I don't think we would have had to have this bill.
We only got a couple seconds left here as we wrap up, so very quick answer on this. Given the way that the language was crafted, how likely is it we're going to have to revisit this exception issue in the future?
We're going to have to revisit some more parts because elective abortion is illegal in Kentucky, and yet they still want OBGYNs to register on a website. And now that it's illegal, we don't think the website should exist, and a lot of people agree with that. And so we're going to look at some of the registry issues and some of the stuff that exists when abortion was legal, that now it's illegal, that are still in the way of doctors providing care for the patients. So we're going to look at some of that as well. But the cause in there is reasonable doctor under similar circumstances, or language something like that, enough that the reasonable term is a legal reasonable term. Like what would another doctor do in this situation? And so that cause, plus listing out several medical emergencies, I think is going to let doctors care for their patients.